performing your own wellness check, your own health check on your puppies, what do vets look for? What should you be looking for to make sure that your puppies are in, pretty healthy condition just by doing an examination here at home? I'm going to show you guys kind of what we look for when we're examining puppies, whether we're purchasing them or whether we're selling them, just overall what you would be looking for, most likely what your vet would be looking for, things like that. Stay tuned. Y'all gonna miss this episode. All right, guys.
I got you right now. What's going on, Bully fam?
What's going on, Bully fam? It's your boy, the educator, the scientist, Mr. Double Muscle 9 Bulls, bringing you another episode of Breeders Hacks. Real quick, this isn't in replacement of your vet. I always still strongly suggest you should go to your vet, get your, health certificates, things like that. But I'm still going to examine the dog myself. Like, say, for example, if I was going to go buy this dog, right? Say I was going to buy this puppy. This is one of our puppies. Beautiful 2x crossbone son. But anyway, I'm sorry. So what I would be doing is there's some things you want to look for before you buy your puppy. You know what I'm saying? There's some things you want to look for before you buy your puppy that you can visually examine to make sure that this puppy is going to be good for you from a health perspective. You know what I'm saying? Identifying problems early on. One of the things, for example, is I'm checking, say I'm interested in this puppy. Say I come to go visit a breeder and I'm interested in purchasing this puppy, or, I'm picking up a puppy, say from a dealing that I did with somebody. Hey, we can breed to one of my dogs, but I get to come and pick up a puppy. These are some of the things I'm looking for. I'm doing my own visual wellness and health check before I even bring the puppy to the vet. I'm visually looking at the puppy myself, prior to going to the vet and having the vet look for me and so on and so forth. So when I'm inspecting the puppy, I'm looking at the puppy, I'm looking at, one of the things, for example, is I'm going to look at the mouth, right? I'm going to look at the mouth and I'm going to see, are the gums pink? I'm looking if the gums are pink. That's always a good sign of health. The puppy's healthy, hydrated, things like that, and then you could take it a step further, and not only are the gums pink, is the tongue pink, then I'm going to look at, is there a capillary response? So I'm going to press onto the gum. I'm going to show you guys. I'm going to press onto the gum with my finger and then let go. And when I let go, it should quickly go back to being pink. So let me show you guys what I mean. Let's see if I can get them real quick to show you. So you see, that's the gum right there, right? So it's nice and pink. This boy's nice and healthy. How do I know? Because he's here with me. Anyway, so now look, this is the capillary response, right? I'm going to try to do it real quick because he's obviously not going to want to sit still. So here, actually, I'll pick him up. Now he's more calm because I have him up in the air, right? So what we're going to go ahead and do, and you could have someone do this with you and help you if the puppy's bigger or whatever the case may be, because this puppy's only 12 weeks, but a 12-week-old Great Dane puppy is going to be a lot larger to do this with. So I'm going to take the puppy, and actually I'm going to try to do it like this. I'm trying to do this so you guys can see. So I'm going to go ahead and take the gum, right? You see the gum right here? And I'm going to press down on it. I'm going to press down on the gum. Here we go. Press down and then lift up. And you see how it went white to pink really quickly. That's a capillary response. A very quick capillary response is a nice, good, healthy puppy. Another thing, right? If you really want to take it a step further, take the puppy's temperature. Depending on their age, a more older puppy like this is already going to be around, their temperature is going to be around 100 to 102, possibly even 103. So, you could take their temperature. If they're above, that 102, 103, the puppy may have a fever, and there could be something going on. There could be something underlying going on. The puppy could be sick, fighting an infection, so on and so forth. And if the puppy's temperature is too low, that'd be pretty bad too, So you can take the temperature. That's another sign of health. The next thing I'm looking at is, how is the puppy acting? Is it lethargic, right? Is it lethargic? Is it just wanting to lay there and not do anything? I mean, some puppies, not every puppy's going to be super energetic, but it's also contingent on the breed. But yeah, I'm going to be looking at how the puppy's acting itself. I mean, look at this puppy. This puppy's just ready to just kind of chew on my hand, play with anything that I put in front of it. Very responsive. I guess that's the better word to put it. How is the response of the puppy? Is the puppy's, intrigued with other things, so on and so forth? That would kind of tell me that the puppy, has good health, right? Another thing that I would be looking at is the ears, right? So we're going to look inside the ears. Is there any, really like crust or black looking tar? Because that would tell me that there's maybe like an ear infection or something like that. These look pretty good. They could be used a little bit of a cleaning, but they don't really go that bad. What else would I be looking at? I would also look at, for males, believe it or not, he's still very young, but for males, what I'd be looking at, I'd be looking to see if the puppy has 2 testicles or not. I remember one time we were looking to purchase a dog, and the dog only had 1 testicle. So obviously we didn't purchase that dog because that dog could have been cryptorchid. So that's another thing you want to check as if males if they have both testicles or not. So another thing is you can perform what we call the snap test, right? So you can literally take the fur on the back of the puppy, pinch it like this, let go. Do you see how quick it snapped right back on the puppy's back? Let's do it one more time. Can you guys see that? Whew, beautiful, perfect. He's like, what's going on? Yeah, I like to do it on the lower end of the back, because if you do it up here by the neck, it's so much loose skin. It's kind of like I don't feel like it's as, I guess I don't think you get as accurate of a reading, I guess you could say. Grab the back like that, and you see how quick it just snapped right back to the body. Actually, you can do it on yourself as well, like to see if you're hydrated or not. That just tells you if the puppy's hydrated or not. But you could do that for yourself. So all you got to do is pinch the skin right here, right? I'm actually very dehydrated, to be honest. I haven't drinking any water. So as you can see, look at that. It's not snapping back. Let me see your hand. Look at her hand. I pinch like this. See, it's snapped back a little bit quicker. You haven't drinking either. You should drink some water. Yeah, so I'm looking at, the next thing I want to look at is the eyes. Is there any film over the eyes? See, he's got a little moco next to his eye. Is there mucus around the eyes? Is there mucus in the nose? That's the next thing I'm checking, right? The next thing I'm doing is I'm actually, I'm not going in for kisses, but I'm actually holding the puppy's mouth next to my ear, and I'm listening to the breathing. Is there congestion in the breathing? Does it sound like crackling when the puppy's breathing? Because that's all signs that the puppy may have an upper respiratory infection, which yet again, if you don't catch it, you bring the puppy home, now you're dealing with it. That's the next thing that I'm looking at, right? Sounds perfectly well. Let me see. I'll hold it next to the mic so you guys can hear him breathing. Can you hear him breathing? That's what you want to hear. Not, or even like I said, there may be a crackling. And if you do feel like you may hear something, you can get yourself like a stethoscope. Take your stethoscope, put it like this, and you can put it on the puppy's chest and try to hear, further if you have a hunch that the puppy may have some type of crackling or something like that. The next thing, like I said, I'm looking at the eyes. Is there any film over the eyes? Are the eyes a nice, healthy, and energetic color? Are they bloodshot? Things like that. That's the whole things I'm looking at. Like I said, you're gonna look at look at the nose, any mucus. You can go ahead and check the mouth, things like that. It should be nice and pink up in there, everything like that. And that's generally what I'm looking at. I'm looking at the movement, right? So I might even put the puppy further away from me and see how it looks walking towards me. Is there any lame to his movement? Is there any hesitation? Is there any sign of, is there any injury or pain when he's moving? And generally at that point, like I said, I may even I'll just put him on the ground and let him walk around and things like that. Maybe if the puppy's too young, you can't do that outside, but you can do that indoors. When I'm just trying to think of it as anything else. That's really what I'm going based off of when I'm looking at a puppy. When I'm trying to perform a wellness or a health check on a puppy, like for myself, if I'm picking up the puppy, buying a puppy, whatever the case it may be, and then obviously I strongly recommend, once you've purchased the puppy, immediately taking the puppy to your vet so that they can perform a health and wellness check and to make sure that, you have a healthy puppy. Like I said, they'll take the temperature as well, so on and so forth, and check a lot of the things that I just told you that they would check. They may even do some further health testing in further detail. Actually, another thing that I just noticed is, like, for example, say I look at his butt too. Look at the butt. I know it sounds crazy. I look at the butt. Now, the reason why I look at the butt is it inflamed. That tells me that maybe there may have been like some diarrhea issues or something like that. I'll look at the butt. What I'll be looking for, that I maybe won't tell a particular person, but I'd be looking to see if the puppy had peed or poo. What does the pee look like? Is it a urine looking color, or is it all white, or is there blood in it, so on and so forth? I'd be looking to see if the puppy goes to the bathroom immediately. That's the first thing I'm looking for as well, is the puppy going to the bathroom, and what does it look like? when it poops, is it diarrhea or is it solid? Is it green or is it brown? Or is it black or is it bloody or whatever? I'm looking at that as well. So you want to see the waste that's coming out of the puppy. Does it look normal or is there something off about it? Those are all things you want to look at when you first get your puppy, because that is the time to tell the breeder or whoever you're getting the puppy from. That's your window that you can tell them either they're going to get the puppy fixed and right for you. But the longer you wait, the puppy can't tell you that there's something wrong. So you have to go off of what you can visually see. I was talking about the males having 2 testicles. With the females, look and see if there's any discharge coming out of her vulva. That's another thing you may want to look at. That's pretty much it, guys. Just go based off of what you can see, what you can visually see. And I just gave you guys a huge tip. See his response was on point. He's looking when I'm tapping the table. You see? Look at that. Very responsive, very alert. That's what you want to look for as well, So anyway, guys, as always, hope this information is helpful. I hope it's useful. And we'll see you guys on the next episode of Breeders' Hacks. Drop a comment down below. Let me know what you guys look for when you're kind of inspecting your puppies. All right? I'll see you guys in the next episode.
This is the thing too that people don't realize. Like for example, say the dogs that don't have 2 testicles. I just checked him. I know he has 2 testicles. I felt him is small. But people think that it's just specific to their breed. The bullies, people think that that's just a bully thing, or Frenchies. I've seen a lot of Frenchies with it later, but from somebody from my situation where I've talked to a ton of breeders, I've seen I've spoken to Cocker Spaniel breeders who had it, Saint Bernard breeders. It's like some type of mutation or something that it just happens in every breed, and they don't know what causes it. You know what I'm saying? So I have the video where it's we use a certain hormone to help bring them down, but it's never always guaranteed. But it's crazy. That's real. You know what I'm saying? That's real. So it's you have to really look for that, because imagine if that testicle don't drop, then you got I wouldn't. The other problem too is if it doesn't come down over time, it can become cancerous. So that's why it's look for it early on. Like I said, that's the key. Let's backtrack. He's already 3 months, and I could feel both of his testicles. You know what I'm saying? Some people they'll be some people they'll be the dog's 6 months and there's nothing there. I'm already checking. I'm already checking to make sure they're there. Sure. So just to know, because then at 3 months I'll start him on that hormone early to try to get them to drop. But I've been pretty good. Like I said, I've been breeding for the past decade. I've only produced it once. So, but I don't feel bad that there's something wrong with my dogs, because when I start to speak to other breeders, they've all produced it. So
it ain't that much.
It's not that bad.